Welcome everyone to this video about trochleoplasty surgery, and it's mainly about the arthroscopic version. So the trochleoplasty, that is a special surgery. It's an operation where you try to create a normal looking trochlear groove in order to provide stability to the patella when there's patellar instability. The arthroscopic version of the trochleoplasty was invented in 2008 by me, so it's now 16 years down the line. It has some advantages. It's minimal invasive surgery, means less pain, smaller scars, less risk of arthrofibrosis, less risk of infection, less risk of cartilage flap breakage, and you can do it as outpatient surgery, and it's easy to combine with more major surgery without giving a huge surgical trauma. This is a video where we start looking at the infrapatellar plica that is removed, it's not needed, and then we look at the trochlear. This is the trochlear groove, or actually there is no groove, it's flat, and we see a small cartilage lesion on the rear side of the patella that is smoothened. Then we go to the suprapatellar pounce, and here there is a suprapatellar plica. This has to be removed in order to give good vision into the joint. So I put in this switching stick and put in my camera looking from above. And here we see a flat trochlear groove and the patella. This is how the MRI looks like. And again, we're back in the knee, and I place a needle in order to find the right spot for my working portal. I'm gonna make an incision for my portal. Here it comes. And through this, most of the surgery is done. I use this radiofrequency device to take away synovial tissue because otherwise I cannot get in with my shaver burr. I take enough away to place my anchor later. And this was the view. We're looking from above, and I put in my shaver burr. With this shaver burr, I go into the cleavage between the cartilage flap and the bone and create a deeper trochlear. And I just slowly work my way deeper and deeper into the knee. Then I change the view, so now I look through the lateral portal and I put in my shaver burr from above. Sometimes this is helpful. However, in this case, it didn't really help me out, so I went back and now I look from superior again. And I put in this chisel or osteotome to release the cartilage flake and to create a lateral wall to provide stability to the patella. This is just like when you do open trochleoplasty. And then again, I go deeper and deeper into the knee. And here I test the elasticity of the cartilage flap. It was not elastic enough. So I go in with this power rasper. First I create this lateral wall to provide stability, and then I take away bone on the rear side of the cartilage flap in order to make it more elastic. And I go a little deeper because I find this needed, and I'm gonna shape my trochlear, and I'm gonna reach the cartilage flap finally. So now I check again for the elasticity, and you see it's much more elastic, and I'm actually ready to reinsert the cartilage flap. For this, I will use an anchor loaded with some reabsorbable sutures. altogether 5 sutures, making 10 strings. And then I will grasp 3 of those sutures. They will be brought up in the upper part of the knee, and with those I will reinsert the cartilage flap with the next anchor. I will tighten up the sutures so the cartilage flap is pressed down into the new trochlear groove. So I will change my view, because now I will look again from lateral and I will grab the sutures from above, because now I'm going to place a medial anchor or inner side anchor. And after having done this, I notice that I need one more anchor. So I change my direction again. So I look from superior and I grab the last 4 sutures and make insertion of the last anchor. And now you see a very nice trochlear, and I will test if the patella fits into this new trochlear, and it does. So I'm gonna do an MPFL reconstruction, and this is how it looks. So just to end up saying thanks to Arthroscopic for providing their new Synergy panoscope with 4K to capture this video. And thank you to you for watching the video. And I'm just going to say that I have published a book, the only book about trochlear dysplasia. Thank you.